Healthcare and financial services group Discovery has become the second major corporate in South Africa to make it mandatory for all staff to be vaccinated. Private school education giant Curro was the first to make the suggestion. Many other large firms are still considering the legal implications of this. Across the world, businesses and governments are opening up certain activities only to those who are vaccinated, and the vaccine passport concept is developing. To unpack the story, I'm joined by COSATU Parliamentary Coordinator Matthew Parks. Matthew, good evening to you, and thank you so much for your time this evening. I read your statement. You're looking at Discovery and you're saying that this is a decision you're unhappy about. Tell us why.
Look, our position as COSATU is that we support vaccinations. We need to encourage everybody to embrace it, to educate them on the reasons why they need to do it, how it's going to help save their own lives. It's been proven to be very effective in saving lives, how it protects their families, how it will enable the economy to reopen safely, to save jobs and to get South Africa moving again. But I think our difference is that we need to encourage people, we need to incentivize them, we need to help them to embrace and to understand why they need to vaccinate. What we don't want to go the route is the route of a police state, where we force people, we drag them kicking and screaming. If you look at what happened in the US, where vaccines have become politicized. So we don't want to go that kind of a route. When we go the route of forcing people, forcing workers at a workplace to vaccinate, or fear of dismissal, all it does is to distract everybody. It polarizes a very sensitive issue, and it creates unnecessary distraction. We must also remember that medical science is always based upon the patient's consent, whether it's for chemotherapy, for people who have cancer, whether it's for ARVs or people who are HIV positive. So I think our approach is we're supporting the objective. Everybody must vaccinate. That's clear. But I think our approach is to do so in a way which respects the Constitution, respects the individual decisions of everybody, and including the rights of workers not to be victimized. But look, if you look at the Discovery statement itself, it's actually not exactly as the headlines in some media have been. They actually have followed the Ministerial Occupational Health and Safety Directive, which says, yes, we encourage people to vaccinate. They say they want to do so at Discovery. But I think they've also acknowledged that the right of anyone to decline it, including for constitutional reasons, for medical grounds, and so on. And I think what has also helped that in the statement they have responded to our position, which has said that if you would choose not to vaccinate for their own personal reasons, let's see if there are ways to engage them, to counsel them, to convince them. And of course, let's also find ways to provide alternative space for them to work in. So I think that is a positive approach. It's a bit different from the media headlines. But our position is let's support the vaccine, let's get everybody to vaccinate, but let's do so in a way which supports their constitutional rights and which encourages and embraces people, educates them, but let's not become a police state and victimize workers.
And while one may get that, Matthew, but how do businesses then begin to balance between the rights of the vaccinated who are saying that they're not comfortable working with those who are unvaccinated, and at the same time respect the rights of those who are saying that for them, given maybe religious beliefs, constitutional beliefs and all of that, who say that they don't want to be vaccinated?
No, look, it is a juggling act. It is a balancing act. And you're right. I mean, this can create workplace conflict as well between a majority of workers who might vaccinate and a small minority of individuals who have not vaccinated yet. I think what we've been trying to do as COSATU and our different affiliates across workplaces is to educate workers on why they need to vaccinate for their own individual health, to save their own jobs, to save their families, to grow the economy. Employers also need to do that. And in fact, in the ministerial directive, it actually says employers must consult with the workers, with the unions on the need why they should vaccinate. I think if we do that, most people are logical, most people are reasonable, most people believe in modern science. I think the majority of us will do it. But clearly there is a need for all of us, from trade unions to governments, to employers, to the media, etc., to role models in society at large, to churches, to convince every single adult on why they must go out and vaccinate. I think our vaccination numbers, while they might seem positive on a daily basis, about 250,000 people vaccinating on a day, we need to actually double it if we're going to reach a 70% plus population immunity by Christmas. But the way you do that is through education. You're not going to physically be able to drag 15 million people who don't want to do it. But we think we can do it. Most people are rational human beings. We get vaccinations throughout our life. When your child is born, you vaccinate your child for polio, for cholera, many other diseases, measles. When you take a child to school, Europe, you produce your vaccine card. When you travel to other parts of Africa, you get yellow fever immunization. So we think we will get there. It does take time, but we need to bring people with us. We don't need to victimize people. So it's a complicated balancing act, and we have to get it right. And again, I think the time is against us. We don't have the luxury of time. So I think for us, it's about really educating people all the time on why they must do this. I think we must also bear in mind, Bongi, that the initial research shows that the vaccines last about 6 months into the full efficacy. So you might find a scenario where we need to, all of us, vaccinate twice a year for the next few years until a stronger vaccine develops, etc. But what is quite positive is that the research around the world has shown you what a huge impact the vaccines have on your life. It has a huge impact on protecting you from the virus. If you do get infected, it's a very small chance. But if you get infected, you will not get seriously ill. You will not need to go to a hospital. You will not wind up in an ICU. You will not wind up dying. So there really are positive things to it. I think it's incumbent upon all of us to help make sure that we get vaccinated as individuals, that we take off our spouses, our children, our relatives, our parents to go and get vaccinated. If we can all do that, we can easily achieve the 100% population immunity levels quite quickly. But if we don't, if we delay, if we listen to social media gossip, which is blatantly false, if we give in to the anti-vaxxers, then yes, we will be in serious trouble and workers will lose their jobs. So we can't afford that kind of a scenario.
Now, how then, Matthew, do we then begin to remedy this? Because I do think that from what you're saying, especially when it comes to the message around the anti-vaxxers and all of that, that is not necessarily the responsibility of companies as well, as much as it is the responsibility of government to make sure that it communicates in a way that is targeted here. So companies really cannot be put in difficult positions, one might argue.
No, look, government can do so much. Yes, government must play the leading role, for sure. That's the role of a government. Sure. But I think we cannot outsource such a critical task to government alone. This is a global pandemic. It's unprecedented. 83,000 South Africans have died. Millions of South Africans have been infected. It's cost last year in a lockdown 2.5 million job losses. So I think we cannot outsource all of our responsibility to government. Employers have a responsibility, so do churches. Every priest at a Sunday service must communicate a message of why we need to vaccinate. Every trade union leader must go to the membership, convince them, mobilize them and their families to vaccinate. The same thing with traditional leaders, with councillors, with media platforms, etc. So I think all of us have to do it. And again, we don't have the luxury of time. And it should be an easy message to sell, but we do appreciate in a democracy, you have many different viewpoints, as we've seen, surprisingly so at times. So there is a significant component of society, not just here, but across the world, even in developed countries like the US and Europe, where people are very hesitant around the vaccine. So I think really it's incumbent upon every single one of us to assure them, to comfort them, to explain the benefits of it. I think that is the way to go. I think for us to grab people and to physically force an injection in the arm will only lead to conflict and will only lead to a polarized debate and delays, to be honest. So I think for us it's about educating people and showing the benefits of science. And science has helped us. The ARVs, for example, helped to increase life expectancy at the height of the HIV/AIDS pandemic. Many other pandemics have been defeated through vaccines like polio, measles, cholera, etc. So this is going to work, but I think we just need to make sure we embrace everybody, take everybody with us, and also that we don't wait for government to do it. Government doesn't need to come to my house to make sure that I bring my wife, my child, my children to vaccinate. We should do that as parents, as family members. So if we can all do that, we can get through this very quickly and safely. But if we don't, then we're going to pay a heavy price in terms of jobs being lost, companies closing, sectors collapsing, and thousands dying needlessly.
I do want to ask you this because, I mean, you are representing the workers. Companies in the future, especially given what we are seeing lately, is that they may now require people to get vaccinated, and they may just put this as one of the requirements for somebody to then be employed. Are they wrong?
Look, that's a difficult one. We'll have to debate that quite a bit as well. I mean, there are many vaccines that were all required as parents when our children are born at hospitals to get them vaccinated. When you take a child to school, the school requires a vaccine clinic card from you. When you travel to yellow fever zones in Africa, South Africa won't allow you back in the country if you don't have a yellow fever certificate. So look, I can't predict the future. I think we've seen different initiatives across the world. Some countries have gone that route of requiring vaccines certificates to go to public places. I think for us, we are a constitutional democracy. We must respect the rights of everybody and really go the route of education. But I think we also need to have discussions about how can we incentivize people to vaccinate. Can we, for example, allow theaters or sports stadiums to be reopened on the condition that you get vaccinated? That could be a way of saving those industries, saving those jobs which are hanging by a thread because of the disaster management restrictions on public gatherings. It can also be a way of rewarding people to vaccinate. But at the same time, it's an incentive-based approach, not a punitive-based approach. Because when you punish people, when you victimize them, all it does is produce a backlash, which we need to avoid, because we really need to be moving forward together in one direction as a society.
Matthew, how much of this, especially the concerns here, are also based on the fact that, some are saying that there are, some deaths that may have been allegedly linked to people having taken the vaccine, and people are saying that information on those investigations is not forthcoming, it's not being made public. How much of a concern do you think this is also playing towards making sure that more and more people do go get their shots in their arms?
Look, the research we have seen, which has been shown across South Africa internationally, which has been held up to the highest standards of scientific scrutiny, has shown the vaccines are safe. You might find 1% out of 3 million might die for whatever reasons, sure. But compare that to 83,000 who have died now because they're not vaccinated in South Africa. Compare that to millions who have died because they're not vaccinated across the world. So I think the odds are there in the vaccine's favor significantly. The research has shown that those who have received the vaccines, for example, our health workers here, our nurses and doctors, our paramedics, have their immune levels have been significantly boosted. Last year, we lost hundreds and hundreds of nurses to the pandemic. We've seen now, because they were the first to be vaccinated, how they've been significantly protected, and the death rates, the infection rates, the hospitalization rates have plummeted. I think our appeal is that when people go on social media, on Facebook, etc., when they go on WhatsApp platforms, to not take every bit of media gossip seriously. I think rather to look at scientific based research, which have been shown, look at mainstream newspapers and media platforms, which provide credible research, but look across the world. Go to the World Health Organization, go to SABC, to GCS here, South Africa. The vaccines have been shown to be very safe and to actually have had a huge impact. If you look at other countries in the world where they've gone the vaccine route quite early, it's helped to bring down infection rates massively, helped to lower death rates massively. We're seeing it already here in South Africa. I think we'll see it going forward as more and more people vaccinate. But look, you live in a democracy. There are a lot of crazy conspiracy theories out there. So I think it's incumbent upon all of us, especially the media platforms, especially government, health institutions, to debunk some of the silly myths going out there. But also people need to be mature and not listen to every little bit of gossip they hear at a party, at a shebeen, talking to their friends on social media, to be a little bit more serious about life, because this is a very deadly disease. It has a huge impact upon jobs. Millions have lost their jobs in South Africa. Government's finances are bleeding, which means that public services that the poor depend upon are going to suffer. So I think we really need to embrace science, and science has always been shown to save our lives, to improve the quality of life, to enable the economy to move, to enable jobs to be saved and created. But look, this is only going to work if all of us do it. If some of us choose to sit on the sidelines, it's going to hold back the entire nation. And those people, to be honest, are not helping us. They need to come and embrace this thing, because workers' jobs are hanging by a thread, and we cannot afford to be delayed by some who prefer to get their research from Facebook.
And Matthew, I know we're almost out of time, but please be brief on this one. I can't help but ask you this as we speak. There's other workers who have been quite disadvantaged, severely so. 2 months, workers of the governing party, a member of the Tripartite Alliance, which you are part of, have not been paid. What has been COSATU's view on this?
No, we condemn it in the strongest possible terms. It's unacceptable. Workers must be paid what their salaries which are due to them. The employers who deduct pension funds, UIF contributions, etc., tax deductions, must pay to the authorities as required by law. We have raises with the ANC. Many of the ANC staff members are also members of NAHAU, one of our affiliates. We support them in their protest action, in the strikes, on their go-slows. They are fully protected by the labor laws. The ANC staff are workers like any other staff. They must be treated within their rights, according to the Labor Relations Act, the Basic Conditions of Employment Act, etc. We've raised a very sharp with the ANC. This is unacceptable. They must get their house in order. They must respect workers, including their own staff. It's simply unacceptable. The ANC staff members are mothers and fathers. They are husbands and wives like anybody else. They've got bonds to pay for. They need to pay for petrol to get to work. They need to buy food to feed their children. So it is unacceptable what the management of the ANC has done. We are engaging with them. We understand the difficulties they experience like any other political party. Political parties struggle to get funding, but that does not mean that you must abuse the rights of workers. They must be assisted to fundraise, sure, but they must also get the house in order, because it is a criminal offense not to pay taxes which you have deducted from the salaries of workers, not to pay the unemployment insurance funds or the pension contributions. But look, the ANC is our ally. We want to assist them, but equally they must assist us to help them.
All right, Matthew, thank you so much for your time this evening. That was Matthew Parks, COSATU's parliamentary coordinator.